Hello everyone. Today's video is just a brief summary, assessment, and opinion about coronavirus right now. I know we're being overwhelmed with a lot of advice and a lot of updates, and that's going to be part of my advice is to turn off the television because it can become overwhelming, and we're already seeing a lot more anxiety both in postpartum moms and in children, especially children who are seeing too much television coverage. So let's try to keep their lives as close to organized and similar and structured as possible when they're facing a lot of this upheaval and change. And the more anxiety they hear about on the news and the more worried they see their parents, it can make them have increasing anxieties as well. So just be careful. Do answer their questions honestly, but you can also be very reassuring with them. And I bring you reassurance today as well because fortunately, the coronavirus or COVID-19 does not seem to specifically attack children. In fact, they seem relatively spared. I'm not saying 100% of them won't have the disease. In fact, they may get the disease. They just seem to do pretty well with it and may have symptoms of a simple cold. And if so, it is perfectly okay to treat their symptoms like a simple cold. It is not necessary to have testing done on somebody who is asymptomatic or is somebody who has very mild symptoms. It's not at all necessary. At this point, because of both changing strategies and because of a lack of testing, most of the time the coronavirus testing for children is only done on those who would be sick enough to be hospitalized. So that decision would be made in the emergency department or on the pediatric floor or intensive care unit, not in your routine doctor's office. So please don't call them right now to come in to get testing done. And it's just not necessary. So let me tell you, this is changing. The advice is changing. The recommendations are changing by the minute. It seems like definitely by the hour and day. And so today's video is being filmed on March 24th of 2020, just with some few quick updates and advice. But understand that what I'm saying now may very well change later. This week is a very critical week because we have moved from tracking each individual positive and all contacts and tracking their motion to understanding that now the disease is becoming, the virus is now community acquired. And so we're just trying to contain it as best we can. So there is no government conspiracy here, guys. There is no sort of effort to hem you in and inconvenience you. This is absolutely just an appeal to all that's kind and good in your heart to protect those around you. While your children may not be seriously harmed by the virus, they could certainly spread it to other people who could be. So this is a matter of being community-minded, civic-minded, kind to your neighbor to keep yourself and your children at home absolutely as much as possible. And this applies to many situations. If you do have a child that needs to be seen in a healthcare facility, one parent takes one child. Don't take the whole family. I can't tell you how many times back when the world was still more normal, I would walk into a well visit and there could be 3 or 4 or 5 other children in the room, 1 or 2 parents and a grandparent. And I love big families. I have a big family, but it's very chaotic for a well visit or a sick visit. So right now, particularly, do not take any extra people with you anywhere and stay at home all the time. I know it can get boring. The kids are out of their routine from school since they're home on this mandatory quarantine right now, but while they're home, try to keep their lives as structured as you can. For example, try to have the same wake up time, try to have the same bedtime, try to have the same rules and limits and snacks and meal times. Anything that you can do to keep their life in a normal routine is healthy and good for your own mental health as well. And it's also good for their mental health and yours to make some daily goals. And my first suggestions would be get outdoors when you can, not with large groups of other people, not with play dates, but just outdoors in your own yard. Try to get some natural sunlight each day. The exercise is very helpful, so I would recommend that for sure. So I want to give you a few updates on what where the practice I'm currently working is doing, and I'm very grateful for our administration for being very proactive about all this and staying up to date just with daily changes, daily emails and conference calls with changing how we're doing things. This is how we're doing them right now. For indoors in our offices, we are only seeing well children and sick visits that have no fever or respiratory symptoms. If the child has any respiratory symptoms or any fever, they have to be seen in our drive-in or drive-through clinic. And we have a whole complex protocol we're following. Initially, when a patient would call in for illness concerns, they would speak with a triage nurse, and she would step them through all the things that they could do at home, supportive care measures. If the child needs more than that, we have started doing telehealth, and many practices have, which is very useful. We can get a lot of information from a video call looking at the child. We could see a rash, we could see if they're having difficulty breathing, we could see all sorts of things. Now, we can't do strep swabs or flu swabs over the phone or video calls. Obviously, we can't look in their eardrums on a video call, so that is difficult. So partly for these reasons, we've started doing this drive-through clinic in which the phone nurse would then get, or the telehealth doctor on the video call would feel the child needed to be seen in person, but we're not contaminating the indoors of the building. So then they would drive up to the beginning with an appointment of this drive-through clinic, get a nurse triage with swabs for flu or strep if indicated, oxygen levels, vital signs, and things like that, and then go on to the tent with the provider who would see the patient. And we're using a scribe so that the provider can have full personal protective equipment in place to see the patient while I'm telling the nurse or the scribe what to put in the patient's chart as they go through. And then we can prescribe antibiotics if indicated, if they had strep or an ear infection and things like that. So this is what we're doing. Various offices are doing various things. It's very tricky in pediatrics. Many adult offices are just postponing all their routine well checks, which is fine. Everybody has to make these calls depending on their individual practice and scenario. But because we have very young children who don't need to get behind in their routine vaccination schedule, we're still seeing newborn weight checks, 2-month, 4-month, 6-month, 9-month, 12-month well checks indoors, and even some older ages as well, but with a big emphasis on the younger ones so that they don't get behind in life-saving vaccines that could protect them from other germs and diseases that are still out there. By the way, we are also still seeing flu, so that can be a big mimicker right now of coronavirus. So I just want to offer you reassurance that all the rules are the same as before this coronavirus came as far as seeking an additional level of medical care. So if you have a baby or a child with cold symptoms, you still do all the same things we've taught you to do through the years. For infants, saline and bulb suction syringe, elevation of the head of the bed, the use of a cool mist humidifier, encouraging fluids, monitoring urine output. So there is an additional video on babies with colds. Please see that. We're only concerned, just like always, if they have signs of dehydration or if they're having symptoms of respiratory distress, such as nasal flaring, grunting with each breath, or retracting with their ribs coming up and down, or using their abdominal muscles to breathe. Similar rules apply to older children as well, and there's also a video on children and teens with colds, and I hope you find those helpful. So those rules still apply. I don't want you to feel, even though everything seems very different now, all those things are still the same. You're still the best caregiver for your baby and child when they have cold symptoms, and only need to seek additional levels of care if you see those concerning signs. So I don't want you to completely panic or freak out about this, because as I said, children, thank goodness, are much less affected than older adults, especially adults who have additional risk factors with this particular virus, which is good. Let me make sure I told you everything I wanted to. Please contact your individual healthcare provider if you have questions about what policies they've instituted to manage this crisis right now. You should have gotten some sort of communication from them, such as an email. If not, you could also check their website, and that's usually going to tell you how they're handling this right now. Be very careful with the person you send out to get groceries. Only send out one person, and make sure they're doing careful hand washing. Oh, and one more quick little note, something that drives me crazy is when I see people in public and they have on gloves. First of all, we have a huge shortage of personal protective equipment, PPE, for the frontline healthcare workers. Please don't use that if you're not a frontline healthcare worker. That's the other reason we split into outside drive-through and inside well care. We don't need PPE indoors with healthy children, but the people, very brave people in the drive-through lines do. They need it all. So we're hoping to help save that and make it go a little bit further by splitting like that. But when I see people in the grocery store with gloves on, this is what usually happens. They put their gloves on. Understand, we would use that to touch something contaminated, and as soon as we're finished touching the contaminated thing, we would take them off very carefully and throw them away. I see these people touching the groceries, potentially contaminated, right? Putting it in their cart, touching their cart, pulling out their phone. Their phone's contaminated now. Touching their face, touching their hair, touching the groceries, checking out, touching their money, going home, I guess, with the groceries still on and touching their cabinets and counters. That's not how gloves work, really. If anything, that may make them less likely to wash their hands thoroughly, at least 20 seconds, warm running water with soap. Because they have this false sense of security because they have the gloves on, that's really just wasting that PPE equipment and doing them no good, maybe even spreading germs worse. So there's really no need to wear gloves unless you know how they work. And we really don't want for you to be wasting them. If you don't mind, let's save them for the healthcare workers who are dealing with this. So I hope those are just a few of my thoughts on my mind I wanted to just share with you guys. The biggest take home is have some structure at home for everybody's sanity. Take this very seriously out of kindness and compassion for others. I do think this is temporary. This cannot last forever. We're going to look back on these days and say, whew, I remember when we survived that crazy pandemic, but we did have more family meals. We did have some high quality family time together. Find your old Wii games. That's what we did, playing a little Just Dance, playing card games. There are all kind of great things you can do with your kids at home. Don't stress too much about getting the academic work done. It's important, yes, but it's not the most important thing if it's causing inordinate amounts of stress. And also, don't compare this experience, this sort of mandatory homeschooling to we're regular homeschoolers, even not in pandemics. And this isn't really how we usually do it. We usually get to do a lot more fun things and we're not stuck at home. So if you were ever considering homeschooling, this is not it. This is a whole different thing, just so you know. So I hope all these little tips and suggestions and strategies and explanations were helpful. As always, let me know if you have additional questions. Thanks.